Ever felt butterflies in your stomach when you're nervous or nauseous when stressed? Well, you're not alone. This fascinating phenomenon is due to the intimate connection between your brain and your stomach, often referred to as the second brain. Your gut is packed with nerves and is highly responsive to your emotional state. When you're feeling stressed, your body's fight or flight response kicks in, and digestion is not a priority. This response suppresses your digestive system, slowing down the contractions of your digestive muscles and decreasing the secretions necessary for digestion. On the other hand, the relaxation response, often known as rest and digest, activates your digestive system. If this stress response is triggered too often, it can lead to digestive issues, and even conditions like irritable bowel syndrome and ulcers. So, it's clear that stress and your stomach are closely linked. But how exactly does this happen? To understand this, we first need to take a closer look at our body's stress response. This is an automatic process that kicks in when we perceive a threat. It's like an emergency alarm system that prepares our body for immediate action, for fighting or fleeing. Interestingly, one of the body's responses to stress is to inhibit digestion. Why? Because digestion is a process that requires a lot of energy and resources. When facing a threat, the body decides that these resources could be better used elsewhere. So, it slows down the contractions of the digestive muscles and decreases the secretions needed for digestion to reroute these resources to the fight or flight response. Now, if the stress response is triggered occasionally, that's not a problem. The body is designed to recover and return to normal functioning. But what happens when this response is triggered too often? Well, that's when things start to get a little tricky. Frequent activation of the stress response makes it harder for the body to recover. This can impede the flow of digestion, leading to stomach upset. Over time, this could even contribute to the development of conditions like irritable bowel syndrome and ulcers, so the digestive system can't function properly with too much stress or stimulation. It's like trying to run a marathon with a sprained ankle. It's just not going to work. This is why it's so important to practice activating the relaxation response as often as we can. This is the body's counter to the stress response. It's often called the rest and digest response, and for good reason. It activates the digestive system, allowing it to get back to doing what it does best. Frequent activation of the stress response can have serious impacts on our stomach health. But what symptoms might you notice? When we're stressed, our bodies can respond in a number of ways, many of which involve our stomachs. Let's take a closer look at the range of symptoms and conditions that can arise due to stress. Many people are familiar with acid reflux, which can be triggered by stress. This uncomfortable condition results from stomach acid flowing back into the esophagus, causing a burning sensation in the chest. Stress can also lead to bloating, a feeling of fullness or swelling in the abdomen. This can be due to slowed digestion or the swallowing of air during stress-induced rapid breathing. Constipation, a condition where bowel movements become difficult or less frequent, can also be a result of stress. When our bodies are under stress, our digestive system slows down, which can cause constipation. On the flip side, stress can cause diarrhea, a condition where bowel movements become loose and watery. Then there's the butterflies in our stomach, a fluttery sensation that's a common response to stress. This happens when our bodies reroute blood from our digestive system to other areas as part of the fight or flight response. Other symptoms linked to stress include an increase or decrease in appetite, indigestion, inflammation, nausea, and stomach pain or discomfort. But it's not just symptoms. Stress can also play a role in a number of serious conditions. These include Crohn's disease, an inflammatory bowel disease, gastritis, an inflammation of the stomach lining, gastroesophageal reflux disease, a chronic condition where acid reflux occurs regularly, irritable bowel syndrome, a disorder affecting the large intestine, and ulcers, painful sores in the stomach lining or small intestine. Each of these conditions can seriously affect our quality of life, and while they may require medical treatment, it's important to note that managing stress can also play a key role in their prevention and management. These symptoms and conditions can seriously affect our quality of life. So what can we do about it? Fortunately, there are a number of techniques that can help us manage stress and improve our digestion. Let's delve into these strategies and discover how we can incorporate them into our everyday lives to enhance our overall well-being. Firstly, exercise is an effective method for managing stress and maintaining healthy digestion. When we exercise, our bodies are stimulated to release hormones that improve mood and decrease stress. Regular physical activity, whether it's a brisk walk, a yoga session, or a high-intensity workout, can help to balance our hormones and alleviate the symptoms of stress. Breathing techniques also play a significant role in managing stress and improving digestion. When we're stressed, we often tend to hyperventilate or overbreathe, which can cause excess air, leading to bloating, gas, pain, and stomach discomfort. On the other hand, relaxed, slow breathing can counteract these effects. By focusing on our breath and slowing it down, we can engage our body's relaxation response, lowering the stress response and improving our digestion. Relaxation therapy is another effective technique for managing stress and improving digestion. Various relaxation techniques can be used to retrain our body's response to stress. These include practices like yoga, tai chi, meditation, and gut-directed hypnosis. Progressive muscle relaxation and biofeedback are other useful methods that can help us manage stress and improve our digestion. By regularly practicing these techniques, we can learn to control our stress response and promote healthy digestion. Lastly, diet adjustments can significantly impact our stress levels and digestive health. Eating regular meals and snacks throughout the day, rather than skipping meals or eating large amounts at once, can help alleviate symptoms of irritable bowel syndrome, acid reflux, constipation, bloating, diarrhea, and stomach cramping. It's also important to drink an adequate amount of water and balance our fiber intake from whole grains, fruits, vegetables, and other food sources to improve digestion. If we're not eating enough, our gut bacteria's healthy diversity can be reduced, potentially worsening our digestive problems. Therefore, if we're working on increasing our food intake, it's essential to be patient and expect temporary digestive discomfort before noticing improvements. And remember, before eliminating any foods from our diet, it's important to consult with a dietitian. Implementing these techniques can help us manage stress and promote healthier digestion. By incorporating regular exercise, practicing slow and relaxed breathing, using relaxation therapy techniques, and making thoughtful dietary choices, we can effectively manage stress and improve our digestive health. It's all about finding a balance that works best for us and adjusting as needed to maintain that balance. Our bodies are complex systems that respond to our lifestyle choices. So let's make choices that promote stress management and healthy digestion for our overall well-being. As we've seen, managing stress is crucial for maintaining healthy digestion and overall stomach health. Stress and the stomach are inextricably linked. Our brain and gut communicate with each other, and when we're stressed, it directly affects our stomach. This connection is so profound that our gut is often referred to as our second brain. The stress response is a survival mechanism that's designed to help us respond to threats. However, when it's activated too often, it can wreak havoc on our digestive system. The body diverts resources away from digestion to support the fight or flight response, resulting in a slowdown of the digestive process. This can lead to a multitude of symptoms, such as acid reflux, bloating, constipation, and even more serious conditions like irritable bowel syndrome and ulcers. The good news is that we have the power to manage our stress and in turn improve our digestion. Regular exercise, for instance, not only keeps us fit, but also helps in managing stress levels by improving hormonal balance and releasing endorphins, our natural mood boosters. Breathing techniques, too, play a significant role in managing stress. By practicing slow, relaxed breathing, we can engage the body's relaxation response and lower the stress response, helping to alleviate symptoms like bloating and stomach discomfort. Relaxation therapies, such as yoga, meditation, and progressive muscle relaxation, can retrain our body's response to stress, helping us to stay calm and composed even in stressful situations. Lastly, our diet plays a crucial role in managing stress and promoting healthy digestion. Regular meals, adequate water intake, and balanced fiber intake can help prevent a range of digestive problems, from constipation to acid reflux. In conclusion, it's clear that managing stress is key to maintaining a healthy stomach. It's about taking a holistic approach that encompasses exercise, breathing techniques, relaxation therapies, and a balanced diet. Remember, your stomach health is a direct reflection of your stress levels, so take care of your mind and your stomach will thank you.